guys, so today we are going to have a virtual laboratory tour as a part of our discussion on the different sections of the clinical lab. So we are here at Ilocos Provincial Hospital and we are going to have a tour at their clinical laboratory. So let's go! So just like in any typical laboratory, yung unang-una niyong makikita kapag pupunta kayo sa lab ay yung reception area. And sometimes the reception area can also act as the phlebotomy area where the specimen or doon mo nakukunan ng dugo yung pasyente mo. So in any typical reception area, of course, meron tayong mga logbooks, mga inpatient receiving or mga releasing logbooks. Kasi nga, gaya ng sinabi ko in our previous discussion, lahat ay properly documented dapat, di ba? As a part of the clinical testing phase, di ba? On the pre-analytical phase. And of course, you can see here the different types of tubes, your waste bin, yung mga different biohazard trash cans natin, and they are color-coded. And also, as part of our discussion noon sa mga laws regarding the certificates, di ba? So ayan, dapat makikita sila kaagad. Okay? So andyan, nakapost lahat yung mga certificates ng mga medtech and yung mga pathologists. As well as the organizational chart. Because as what I said in our discussion, certificates or proofs of your professionalism should be pasted or posted on a conspicuous place in the laboratory. So I will demonstrate a phlebotomy procedure, okay? So we will collect the blood specimen on our patient. So of course, the very first thing that we do is to check the request form. So dapat properly filled up yan and then tignan natin kung ano yung request ng pasyente. So yung naka-check lang naman dito is CBC. Okay? Lagan mo, sir? Marihan mo dito. Ayun. First step din, dapat i-confirm mo kung siya talaga yung pasyente mo. Okay? So tanungin mo yung pangalan. And how do you ask? Tanungin mo, wag mong sabihin, ikaw ba si? Wag mong gawin yon. Okay? Tanungin mo yung pangalan mo. Of course, the first thing you do is to palpate the vein. Hanapin mo muna. Then, kapag na-palpate mo na yung vein, disinfect. So noon, the proper disinfection is concentric. Pero yung nasa revised guidelines na ngayon, pwede na maraming. Actually, it is more effective na daw. And then, allow to air dry. I-dry natin yung alcohol. And then, let's prepare for our syringe. Prepare na natin. And one thing pala, dapat kapag nag-extract kayo, kapag meron kang patient interaction, dapat naka-gloves kayo lagi. Okay? Tourniquet ulit. Close mo, sir. Bevel up, okay? Yung needle dapat naka-bevel up. Yung butas naka-taas. And then, proper angle. Sir, tusok ko na. Open mo na kamay mo, sir. And then, tourniquet first before you pull out the needle. Okay. Sir, papindot na lang. Pindot mo, sir. And then, next thing na gagawin mo,
Steady.
transfer mo yung blood into its proper collection tube. So, for CBC, EDTA, purple top. So, may line dito, okay? So, hanggang doon lang dapat yung ilalagay natin. And ayun, mapapag-aralan nyo siya next sem, yung proper na mixing. Kasi each tube has their different mixing. And our EDTA requires 8 mixing. 1, 2, 3, 4, 5, 6, 7, 8. Okay, dapat pa-infinity yung flow. Hindi ganon. Because you might rupture the RBC or you might lyse the RBC. And then, ask again for the name of our patient. Pangalan mo ulit, sir? Marino. So dapat ganon, properly labeled, dapat do the labeling after you extract the patient, okay? Para maiwasan mo yung specimen mix up. And essential din na dapat ilagay mo dito sa tube natin yung birthday niya. So we ask again for the birthday. Paano ulit? Yung birthday mo, sir? So kapag tinatanong mo na rin yung birthday, dapat nagmamatch din siya doon sa request form, okay? So ano yung purpose ng pagtanong mo ng birthday? Malay mo, kapag may kapangalan pala siya, di ba? Ayun. So, identification, for identification processes. So ayun, you now dismiss the patient properly and instruct them what to do later on. So ayun sir, itest immediately Daramon, subyanam to after 30 minutes to 1 hour. Ayun sir. And ito na, it will go to our hematology section. So dito sa hospital na to, sa laboratory nito, ang pinakaunang makikita mong section ay yung hematology. This is the hematology section, okay? So as this is a tertiary or secondary lab na, hindi na kami nagmamanual dito. Okay? So we just only do manual when there are some discrepancies na ibabato ng machine. And that's the yun naman talaga yung dapat na gawin mo as a backup. So this is our Sysmex. Yes, this is Sysmex BC5180. So this is the automated CBC counter. So name-measure na niya lahat. We have your WBC count, WBC differentials, RBC count, your RBC indices, lahat na nandito na. Hemoglobin, hematocrit, nandito na. And mainly, the principle of this machine is your electrical impedance, okay? Later on, you will know what is that principle, but I just want to reiterate that it operates under electrical impedance wherein there is a disruption of the electricity as a cell passes by. So ito yung nakikita nyo yung sample dito sa hematology, the violet top, which has an anticoagulant of our ethylene diamine tetraacetic acid, okay? So you have your 8 inversions. And then ganon, enter mo lang yung the data of your patient and then ipapasak mo na siya. Close and then push the button run. What else? What else do we do in the hematology section? Of course, kabilang din dito yung paggawa ng mga peripheral blood smear. Ito yung ginagawa natin kapag pumapalya ang machine natin. Okay, so bali nagmamanual count na tayo. So the next section that we are going to take a look is our clinical chemistry section. So Gabriela has a secondary lab. So ayun, gumagamit na tayo ng fully automated type of machine. So this is Response 920. So kaya niyang gawin lahat ng test. So from your glucose, BUN, urea, creatinine, lipid profile, clinical enzymology, lahat na nandito na. So if you are going to take a look here, these are your reagents. Okay? So each reagent, ayan, each canister, it will test a different analyte. Okay? So, ito yung sinasabi kong name-measure siya via spectrophotometry. Kasi kung nakikita nyo dito, sa part na to, ay wala, naka-off pala yung ilaw. Pero kapag nagro-run kasi itong machine, may ilaw dyan. Yung sinasabi kong i-measure niya, yung light yung papasok doon sa tube, para yun yung i-measure niya kung marami bang analyte, gano'n. And the typical sample na makikita mo dito sa clinical chemistry is your yellow top. Kasi ang kailangan natin dito is your serum, not whole blood. Pwede din naman plasma, pero usually serum ang gamit natin para magkaroon ng less interference. Kasi sa plasma may mga different proteins pa tayo, like your fibrinogen. Sa serum kasi wala na siyang fibrinogen, so it eliminates the false positives or false negatives. So in the clinical chemistry section, makikita mo talaga dito yung mga napakaraming mga chemicals reagents, mga ganun. Gaya nito, mga cleaning solution, mga distilled water, mga waste, ganun. Kasi maproseso talaga tong makinang to. Like kahit konti lang na na variable or factor na mangyari sa reagent mo, like for example, nag-deteriorate siya, ganun, maaapektuhan talaga yung quality or the result na ipabato niya. So hindi na accurate. And what is our goal in our results, diba? Accuracy and precision. So ayan, mga reagents. So this is also a part of our clinical chemistry section, okay? So we have here two small machines. So this machine is our easy light. Mine-measure niya yung ating mga electrolytes. So it operates under ion selective electrode. So meron siyang ion selective electrode sa loob para i-measure yung mga electrolytes natin. Because yung mga electrolytes natin, they are ions, di ba? Meron silang charges. So ayun, serum ulit yung gagamitin mo dito. Na-measure niya dito yung sodium, potassium chloride, and calcium natin. So ayun. And this one is our B-analyst. Na-measure naman niya yung ating HbA1c. Para saan yung ating HbA1c? It is our glycated hemoglobin, di ba? So it measures our blood sugar for the past 3 months. So it is very essential in the monitoring of our patients with diabetes. Kung compliant ba sila sa kanilang medications or hindi. So we move on to the next section. Okay, so we have here the immunology serology section. So ayun, konti lang naman yung makikita mo dito. So mostly kits. Kits ka lang talaga dito. So ano yung mga test na pwede natin i-measure via kit? So we have here your Treponema pallidum. So syphilis. Pwede natin siyang i-measure via lateral flow assay. Ito, dengue duo. So na-measure na natin dito yung antigen and the antibodies, IgM and IgG. We also can measure leptospira. And of course, the very famous, dapat hindi na nawawala yung ating hepatitis B surface antigen for our pregnant women. Usually, we also perform here the erythrocyte sedimentation rate, but we are out of stock. But I will just show you another video for that. Okay? And the usual specimen for our serology is again, serum. We can also use plasma, depending on the insert of the test kit. Okay, but usually we use serum. Of course, they are hazardous or they are considered to be biohazard, potentially endangering our health, so we must put them in a separate container. And of course, we have a timer because each kit has their own time. Like for example, our hepatitis B, we must measure it for 15 minutes. For the syphilis, for 10 minutes only. So ano kasing mangyayari kapag mag-over or under time ka? Of course, kits yan, okay? May possibility na kapag under time, hindi niya ma-reach yung mga lines. Okay? So, pwedeng yung control lang, so magkakaroon ka na ng false negative. Kapag overtime naman, magkakaroon ka ng false positive. Kasi nga, sobrang haba na ng time, sobrang haba na ng pag-wait mo na mag-flow yung immune complex sa lateral flow assay. So, in our serology section, so ito lang yung ginagawa natin. So, mga kits, okay? So yung gagawin mo lang dito, kukuha ka lang ng blood sample or serum. So ayun. So kapag magte-test ka, palaging titignan kung match ba yung or kung properly labeled ba ang ating tube. Okay? So ayun. Kuha ka lang. And paano mag-drop? Paano ka mag-drop ng specimen? Dapat perpendicular, okay? Hindi nakaslant. Kasi iba yung volume na malalagay mo kapag nakaganito. Okay, the standard one drop is measured via kapag ganito yung position, vertical. So 1, 2, 3 drops and then 3 drops. So proper disposal, ayan, for applicator sticks and then set na natin yung timer. Babalikan na lang natin to kapag tutunog na yung timer. So ayun, nakikita nyo parang nagfo-flow na yung specimen, okay? Kasi this part, okay? On this part, dito na part, meron tayong dye na nandyan, okay? And that dye is antigen tagged na dye or antibody tagged na dye, okay? So anong gagawin ng antibody? So titignan niya yung antigen na nasa ating sample. So kapag yung antigen and then the antibody na nandun nag-meet, kapag pupunta sila doon, merong part dyan na parang mamimit niya yung mesh, and then kapag may reaction, hindi sila matatrap sila. So yun yung nangyayari, magkakaroon sila ng line or ayun, madedetect nila, magkakaroon ng line, madedetect yung yung agglutination na part dyan, sa may mesh na part dyan. Ayun, balikan na lang natin yan mamaya. So next up is our clinical microscopy section. So ano yung usual na ginagawa natin dito? Ihi at tae. Okay? So ayun, magpe-perform na lang ako ng urinalysis so that you can see kung ano talaga yung ginagawa dito. Okay? So we have here a urine sample. So first phase on our urinalysis is that we must do a macroscopic examination. Okay? So titignan natin kung ano yung color and the characteristic. So based on my observation, straw colored naman siya and it is clear. Okay? So ilalagay ko sa request or sa result form will be color, straw, and then the characteristic would be clear. Ganun. And then ayun. After macroscopic, of course, we will do the next phase, which is the chemistry part. So, transfer lang natin tong urine on a test tube. Ganyan. And then, ito yung pinapakita ko, di ba? Ito yung pinakita ko na urinary dipsticks. So, ito, na-measure na niya yung 10 parameters like our glucose, bilirubin, ketone, specific gravity, pH, blood, protein, urobilinogen, nitrogen, and our leukocyte. So, each of them, they have their own significance kung magkakaroon ng reaction. Okay? So makikita nyo dito sa mga color charts, ayun, i-compare mo lang siya. But dito, meron tayong machine na gagawa nun. Okay? So ayun, demonstrate ko na lang siya. So ito yun, yung typical na dipstick natin. So 10. So ayun, ididip mo lang siya dito sa ating urine. And then, we blot. Paano ba mag-blot? So yung side lang ng urinary dipstick, ganun yun. Para mawala lang yung excess na urine. Para hindi naman basang-basa. And then we will just wait for 30 seconds to 2 minutes depending on the reagent that we are, or the analyte that we are going to study. But usually we just read it at 1 minute 30 seconds yun. So ayun, nakikita nyo na nag-change na ng color yung mga pads. So ibig sabihin niyan, may nade-detect na siyang mga analytes. So ayun, after mong basahin, or after mong i-dip doon, pwede mong basahin manually, okay? But yung problema dito, it is very subjective, okay? So medyo prone to error siya kung may bias ka lang. So maganda na lang na lagay mo siya dito. And then, siya na yung magme-measure, yung machine na yung magme-measure. Calibrated naman to. Kinakalibrate lahat ng machines dito every 12 midnight. So, ayun, papasok na siya doon. And yung principle naman nito is reflectance photometry. Okay? So, the light refracted is inversely proportional to the analyte that is present on our test pads. Okay? So, ibig sabihin, kung mas marami yung na-refract na light, mas kaunti yung analyte na present doon sa ating dipstick or sa ating pad. So kung mas kaunti naman yung refract na light, ibig sabihin mas concentrated yung substances natin doon sa pad. So mas maraming substances na nasa urine natin. So ayun, babalikan na lang natin yan mamaya for its result. And then, after ng chemistry natin, punta na tayo sa microscopic na part. So ayun, so this is one of the very essential instruments in any laboratory. Okay, so dapat meron tayong centrifuge kasi halos lahat dito talaga sinecentrifuge. Blood, ito urine, any analyte. Kapag magsa-cell block tayo, sinecentrifuge nyo. So ayun, ipasok mo lang, naka-operate kasi kaya hindi siya ma-open, but ganun, ilagay mo lang ito dito, magkakaroon na siya ng 2 parts after. So we have our sediment and the supernatant. So gagawin lang natin, tatapon natin yung supernatant and then yung sediment yun yung sisilipin natin sa microscope. And one thing that I want you to remember when using the centrifuge is that you should always balance it, okay? So, for example, meron kang 6 na butas, so dapat kapag maglagay ka dito, dapat maglagay ka din doon. Dapat balance palagi, okay? Kahit tubig lang yung lagay mo dito, as long as parehas sila ng volume, para hindi to sasayaw or magigewang-gewang. So this is our centrifuge, and when you are going to use the centrifuge, dapat na balance palagi, okay? So kapag maglalagay ka dito ng specimen, dapat maglalagay ka rin doon sa kabilang hole, okay? Para palaging balance. Para kapag magro-rotate na to, hindi siya sasayaw, okay? So ito 'yon. So kinakalibrate din to, depende sa kung ano yung isa-centrifuge mo. Kasi kung urine ang gagamitin mo, o kung urine ang isa-centrifuge mo, iba yung rotations per minute niya, kapag blood iba rin, okay? Okay, so this is now the centrifuge urine, okay? So it has now two parts, the supernatant and our sediment. So anong gagawin natin? Itatapon natin yung supernatant. So ano yung paano natin gagawin? So in a swift motion, ganun lang. Don't hesitate, talagang itapon mo lang yun kasi yung sediment nandun na, hindi na yun mawawala. Okay? And then next, i-disrupt mo lang yung sediment, i-agitate mo lang na ganito, and then you put it in a microscope slide. And then you spread it, and then, of course, infectious na to, lagay natin dun sa infectious waste. And then, lagay na natin sa microscope, and then, ayan, babasahin na natin. And ano yung mga usual na makikita natin kapag urine ito? Yung mga urinary sediments natin. Yung mga diniscuss ko rin, okay? So you have your erythrocytes, leukocytes, renal tubular epithelial cells, lahat ng yan, pwede mo itong makita. And kapag, ano pa ba yung ginagawa natin dito? Fecalysis, okay? Unfortunately, wala tayong stool sample ngayon. But usually kapag may stool sample, yung goal lang naman natin doon is to look if there is the presence of our parasites. So ito yung ating titignan kapag magfe-fecalysis tayo, mga ova ng mga worms natin. Ayan. Usually sa fecalysis din, pina-perform natin yung fecal occult blood test, okay? Fecal occult blood test, it will detect if there is bleeding sa ating gastrointestinal tract, okay? So ayun. Kit din yung ginagamit dito, okay? So it should be on the serology section, unfortunately, but basically it is concerned with our specimen stool nga, kaya sinasama na lang siya dito sa clinical microscopy section. So we are now here in the microbiology section, okay? So ano yung typical na makikita mo sa microbiology section? Of course, our biosafety cabinet, okay? I was looking for the Vitec pero wala na pala, okay? So dito na lang. Ito yung biosafety cabinet natin, okay? So ayun, every microbiology section dapat meron kang ganito kasi nga you are working with microorganisms. So paano ka dito? So basically ganyan lang. Pasok mo lang yung kamay mo dito and then lahat na ng gagawin mo doon sa loob, okay? Ayun, so dito ka na mag-strict, mag-plate, mag-gram stain, lahat na, dapat yan. And then yun. Actually itong mga to, these are our reagents for Vitec, pero na-pull out kasi yung machine, kaya hindi ko mapakita. Yung Vitec na sinasabi ko, it is the fully automated na culture and sensitivity machine for our microbiology, okay? So hindi mo na kailangan doon mag-biochemical testing, hindi ka na magluluto ng mga agars and whatsoever. As in, nilagay mo na doon, ibato na lang niya yung result. Yun na, di ba, napaka less hassle, kumbaga, pero wala yung machine under maintenance. Makikita mo rin dito yung incubator. Incubator to kasi nga some microorganisms require different types of temperature in order for them to live, okay? Yung mga iba, they need 20 degrees Celsius, yung mga iba 37, yung mga iba 42. So ayun, na-adjust yan, depende kung ano yung gusto mong patubuin na bacteria. Dito sa Gabriela, meron silang ginagamit na eye-chroma, okay? So this eye-chroma, it operates under the principle of immunochromatography, okay? So actually pwede mo nang ma-measure lahat dito yung mga hormones, yung mga maliliit na analytes, yung mga umaabot ng micrograms, ganun, or nanograms, pwede mong ma-measure dito. Actually ito, pwede rin itong gamitin for COVID, antigen detection, okay? Andyan yung chip niya. So depende kung ano yung gusto mong i-test, meron kang different chips, okay? So ayan, T3 for our thyroid function. Ayan. troponin for our cardiac function. Kapag, ayun, nagma-myocardial infarction ka. Ano pa? Ayan, T4 for our thyroid ulit. Pero ayun, marami pang test na kayang gawin to. Pero yung disadvantage lang nito, it is single test lang siya, okay? Hindi siya pwede for batch testing. So yung batch testing kasi dapat marami na and then marami ka nang ilalagay para minsanan na sana. Ito, time consuming siya kasi nga isa-isa lang. Depende pa kung ano yung test na require. So ayun, immunochromatography siya. Pero ayun, mabuti na lang din at meron, okay? And ayun, nandito naman tayo ngayon sa blood bank, okay? And as you can see, iba na yung ating environment kasi yung blood bank nila dito sa Gabriela, ibang naka-separate, okay? And usually ganun yung mga blood banks ng mga malalaking hospitals, okay? Lalo na yung mga government hospitals natin. Ayun, so ito yung reception area ng blood bank. So kasi dito sa blood bank ng Gabriela, tumatanggap sila ng mga blood donors, gano'n. So ito yung reception area, waiting area nila. And then we have here, of course, the vital signs kasi in blood donation, you need to measure the blood pressure, the hemoglobin content, gano'n. So dito lahat yung nangyayari. Dito na rin nangyayari yung preliminary blood typing, okay? Kaya nandito yung ating mga anti-sera. So ito yung anti-B, anti-A, anti-B, and then yung ating RH, anti-D. Ayan, so ayan, mga syringes natin. And after the reception, pagpasok mo pa dito, nandito naman ang ating bleeding area. So dito mo papahigain yung ating blood donors, and then kukuhanin mo ng dugo, okay? So ano yung mga makikita mo dito? So of course, our tourniquet, kasi blood donation is actually phlebotomy in itself, okay? Specimen collection. So yun, meron tayong mga stress balls para mag-flow ng dugo during blood donation. And ano pa yung mga makikita natin dito? Dito yung mga pang-testing sana na mga blood bags, pero tinatanggal natin yan. Ito, gumagamit din tayo ng mga EDTA tubes dito for testing. Okay, so ano yung mga tinatest natin in blood donation? So we are screening for 5 infectious diseases. Forgot the one. Malaria and
syphilis.
Okay,
Ulit.
So we are testing for 5 infectious diseases. Okay, so we are going to test for hepatitis B, hepatitis C, HIV, malaria, and syphilis. Okay, so yung ginagawa nating testing na yun yung actually na binabayaran natin kapag nag-acquire tayo ng dugo. The blood itself is free, okay? Pero yung binabayaran natin yung mga yun, tinetest natin yung dugo kung meron ba siyang infectious diseases or yung sa cross-matching naman, which later on we will see. So after the bleeding area, so papasok naman tayo ngayon dito sa testing area, okay? So dito na mangyayari yung mga sinasabi kong testing ng infectious diseases, mga cross-matching. So yun, tignan natin yung mga nandito. Dito, meron tayong platelet agitator dito, okay? Yung mga platelet concentrates natin kailangan constantly agitated para hindi sila mag-clumps or mag-clumping, okay? Kasi kapag nag-clumping na yan, wala na, hindi na siya pwedeng isaksak sa ating mga pasyente. So, by type rin siya. Ayun, ito yung mga request form. So, blood bank is one of the sections of the clinical lab na maraming mga papeles, okay? Kasi nga, this is actually the most crucial or the most critical section of the clinical laboratory, okay? Marami kang ginagawa dito like testing kasi nga life and death ang nakasalalay dito kapag mali yung may saksak mong blood, pwedeng mamatay ang ating pasyente. So also in the blood bank, of course, nandito ang ating mga dugo, okay? Ito yung blood bank refrigerator, maintained at around 2 to 8 degrees Celsius, okay? So ayun, pasok siya 3.6 degrees Celsius. Ayan, type O, type A, type B. Ayan, color-coded din siya. Okay, so kapag type O, white siya. White yung ating label. And nakita nyo naman na dito is our plasma part and then this is our packed RBC. Okay, so kapag magko-component preparation ka lang dito, kung packed RBC lang yung kukunin mo, aalisin lang natin to. Okay, and then you will have the packed red blood cell. Kapag whole blood naman, ito na yung isasaksak. Kapag A, blue, and then B, yellow. Ito na yung mga screened blood, okay? We should have a refrigerator for screened blood and then untested or quarantine units para ma-distinguish mo pa rin kung ano na yung pwede mong ibigay sa mga pasyente or hindi. Kasi yung mga to, they will still be subjected for the testing portion, yung mga infectious diseases na sinabi. So in this part, may gumagawa ng cross-matching. Okay? So ito rin yung mga isa sa mga binabayaran ninyo na fee kapag kumukuha ka ng dugo. Okay? So this ensures na yung ipapasok sa yung itatransfuse sa'yo na dugo, kamatch mo talaga. Okay? Safe na tatanggapin ng body mo. Okay? Ganun. So ayan, meron tayong different tubes dito and titignan mo lang kung merong reaction or agglutination na mangyayari. So ito yung sample and then yung dugo na natatransfer sa'yo. So basically yung gagawin lang dyan, imimix lang yung blood ninyo. Okay? And dito rin, meron din tayong microscope kasi sometimes kapag wala kang makitang agglutination dito, maybe maliliit lang yung or very weak lang yung reaction. So you need to confirm under the microscope. So titignan mo ngayon kung yung agglutination ba ay microscopically, it can be detected microscopically. Ayan, kaya kailangan nilang microscope sa blood bank. Ito naman ang ating mga, actually, yung pinakita ko doon kanina, that is the manual method for cross-matching. Okay? And then we actually have now the gel system. Ito yung mas maganda, mas accurate yung makukuha mong results dito. Okay, so this is an example of our gel testing system. Ganyan. So makikita nyo naman dito, yan. Imimix mo lang yung blood dito, yung blood tsaka yung dugo. And then kapag may reaction, mai-stack sila doon. Okay, so ibig sabihin nun, hindi kayo compatible. Pero kapag bababa yung dugo ninyo, andun, sa pinakababa mismo, compatible. Okay? Ibig sabihin, walang reaction na nangyari. Kaya lumusot sila doon sa gel. Ito yung centrifuge niya. Parang specialized centrifuge for that gel system. Talking about the gel system or the gel system is made up of our polyacrylamide gel, okay? So, ano yung ginagawa ng polyacrylamide gel? So, it acts as a mesh na naman, okay? So, kapag may agglutination na nangyayari, kapag yung tatransfuse ng dugo at saka yung dugo mo, hindi compatible, magkakaroon ng reaction, yung polyacrylamide gel, hindi niya yun i-peppermint na bumaba. Kaya yung pinakita ko. We have here the blood component centrifuge. Okay, so yung pinakita ko kanina ng blood doon. So kapag freshly collected kasi yun, pwede nyo ma-segregate yun into 3 components. Okay, so you can have your packed red blood cell, your platelet concentrate, and your fresh plasma. Okay, so yun. Ito yung gagawa nun. Siya yung mag-centrifuge para magkaroon ka ng different layers. And also in the blood bank section, in the testing area, we can see this machine. This is our Premier USA ELISA machine. Okay, ELISA, E-L-I-S-E machine, enzyme linked immunosorbent assay. Unlike sa serology section natin sa clinical lab na gumagamit ng kits, dito sa blood bank, gumagamit sila ng ELISA, which is very much more accurate and more precise when it comes to detecting our infectious diseases. Okay? So ayun, kaya you can say talaga na yung itatransfuse sa yung dugo, safe na safe siya kasi we are using a state-of-the-art machines that actually helps you eliminate or detect those kind of diseases. Also, kapag pupunta kayo sa mga blood banks, baka magulat kayo bakit may malalaking mga cooler. Okay, actually this is not a cooler, this is actually a refrigerator. Dito mo ulit i-store yung mga freshly collected blood mo or sometimes yung mga screened blood mo. So, as an alternative sa ating mga ref kanina na pinakita ko, pwede din natin itong gamitin. Okay? Actually, ito, pwede mo rin siya i-set into a freezing temperature para magkaroon ka ng fresh frozen plasma. Para ma-freeze yung ating plasma so that it can prolong its shelf life and you can actually thaw that later on para isaksa for our coagulation factor. And now we are here on our working area. Okay, so dito na nangyayari ang ating post-analytical phase kung saan susulat na natin yung mga results. Yung mga results na hindi computerized, dito na natin sila susulat. And then we should record them. Ito yung mga pinaka-critical din na dapat mong gawin dito sa clinical lab. Okay, so dapat lahat documented from the beginning to end. Di ba pinakita ko kanina dun sa reception, meron tayong receiving logbook. Para kapag may troubleshooting, you can actually track kung saan ka nagkamali. Okay, lahat na ginagawa mo properly documented. Ayan. So this is an example of result for urinalysis. And ayun. For example, ito rin yung mga nagawa ng results. Okay, so ito yung CBC report. So ayan, blur lang natin yung pangalan ng pasyente. Ayan, makikita mo naman na dyan yung different parameters ng CBC natin kanina. And then yun, kung makikita nyo rin dito, na-segregate na siya per ward kasi this is our inpatient results. Okay? Nakaseparate na siya per ward para mas madali nating hanapin. And then, each ward meron din silang receiving logbook. So ito na yung ating turnaround time na sinasabi. Ano ulit yung ating turnaround time? So it is the time it takes for us to produce a result. Okay? Which is very beneficial to our patient. So as you can see, in Gabriela, wala tayong histopath section. Okay? Kasi nga secondary laboratory lang to. So ano yung ginagawa natin sa mga histopath natin? So we are just a collection site or ayun, sinasend lang nila dito yung mga biopsy. For example, itong specimen na to, this is endometrial tissue, curettage. So ayan, ilalagay lang namin yung request dito sa may folder ng histopath and then after a week, dadaanan ito ng pathologist and then dadalhin niya doon sa tertiary lab, usually sa Mariano Marcos. And then doon mangyayari yung histopath proper, yung staining, cutting, embedding, lahat ng yan. And then kapag pagkatapos nila doon, isasend na lang nila ulit pabalik yung mga results. So ayun.